Hello and welcome to the learning series titled Learning Together, Emergency Shelters and Substance Use Centers. Please note this session is being recorded. We're pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French at the interpretation menu on the bottom of your Zoom screen. If you need support at any time during the webinar, you can reach out to one of our producers using the chat feature. My name is Lindsay Yarrow, and I'm pleased to be joining you as co-host for today's webinar. I'd like to start by acknowledging that we're meeting on land that has been inhabited by Indigenous people since the beginning. In particular, I acknowledge that I'm hosting this webinar from Kingston, Ontario, which is the traditional and unceded territory of the Haudenosaunee and Anishinaabe people. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At Healthcare Excellence Canada, we continue on our learning journey and commitment to support improvement with and for all people in Canada. Healthcare Excellence Canada is an organization with a relentless focus on improving healthcare with and for everyone in Canada. We believe in the power of people and evidence and know that by connecting them, we can achieve the best healthcare in the world. HEC is an independent, not-for-profit charity funded primarily by Health Canada. We're pleased to share that this program is delivered in partnership with the Canadian Centre on Substance Use and Addiction and the BC Patient Safety and Quality Council. So we're really grateful you were able to take the time to join us today for this important discussion. We're hoping hearing from our speaker today supports you in your work. But before we get started, Ryan, I'm going to hand it over to you as co-host to introduce yourself and also to introduce our speaker for today's event.
Great, thanks, Lindsay. My name is Ryan McCarthy, and I'm the Director of Knowledge Mobilization at the Canadian Centre on Substance Use and Addiction based in Ottawa, Ontario. We at CCSA respectfully acknowledge that the CCSA offices are located on the traditional, unceded territory of the Algonquin Anishinaabe people. The Anishinaabe Algonquin Nation has been present on and nurturer of this land since time immemorial. We are grateful to have the opportunity to be present in this territory. And now I'd like to take this opportunity to introduce the speaker for today's event. Dr. Laura Lennox is the Improvement Science and Health Improvement Lead at the NIRH Applied Research Collaboration, Northwest London, within the Department of Primary Care and Public Health at Imperial College London. Laura is an applied healthcare researcher and manager with expertise in implementation science and quality improvement. Her work aims to improve outcomes for patients and the public by improving the quality, delivery, and efficiency of health and care services, and increasing the sustainability of the healthcare systems. Prior to joining Imperial College in 2011, she worked as a registered nurse in Ontario, Canada. Laura obtained her master's in public health from the London School of Hygiene and Tropical Medicine in 2010, and was awarded her PhD from the Department of Medicine at Imperial College in 2019. Dr. Lennox's current research focuses on understanding evidence-based implementation, sustainability, and spread in complex systems. Laura, I will hand it over to you to get us started.
Great, thank you so much, Ryan. What a nice introduction, very thorough. Thank you so much for inviting me to speak with you all today. So yes, my name is Laura, and I am currently the Improvement Science and Health Improvement Lead for an organization called ARC Northwest London, which stands for Applied Research Collaboration. And really our aims are all around funding and supporting implementation of any programs that can be used to support the health and well-being of our communities and populations across Northwest London. And it's quite an urban and mixed population we have here in Northwest London. But through our funding, we really want to ensure that we sustain any of the positive outcomes that we have beyond the funding periods. So today I was wanting to share with you some learning we had on basically making change last. We, of course, have been working with our programs and projects to understand their experiences in sustaining, but also we've conducted some specific research to share key learning on what sustaining looks like and how it can be supported through specific strategies. So I was going to walk you through some of those examples today. So if we can just move on to the next slide. Thank you. In terms of the problem, I think it's something that everyone who works in this space can identify. We know that there are significant resources dedicated to improving healthcare and community services. But equally, we understand that many of these new and innovative services don't have a lasting impact on care. And what this means is that many of these projects or programs go back to previous ways of working, or they become isolated improvements in specific communities or specific organizations that aren't seen throughout the rest of the city or the sector. We also know that if you have a program that's running, many of the programs won't continue at high levels of fidelity. And what this means is that a program continues to shift and change as it moves forward. So it will look very different if you go to measure sustainability in the future. That's not necessarily a bad thing. It just means that in order to sustain and understand sustainability, you have to understand that the process might look different than when you originally left it. We also know that large programs can be sustained and they can be maintained and spread. But what we're missing a lot is these connections between what makes something sustain or something fail to sustain. And this has become even more important to understand as we see the rapid implementation of programs to deal with COVID. I think this has been the case in all countries, but what we're seeing is a rapid implementation, but there's the perception that a lot of these benefits might be lost in the future if we can't consider how they can be integrated and maintained through future funding mechanisms or integrated properly within systems. Just moving on to the next little thing. Yes. So I took a look at your previous the previous webinar that was given to this group and just seeing the identified challenges, and they really do resonate with the challenges that are being seen by our own programs in terms of lack of understanding or continuation of healthcare support and funding, being able to maintain resources, staff at the same levels that you were initially given. So these are all problems that hopefully it'll be some solace for you to understand that you're not alone in these challenges. This is being felt all over the world. But hopefully some of the learning from today will also allow you to have some steps or actions you can take to ensure that you can do your best at maintaining some of these gains. And next slide, please. So before I move on, I just really wanted to get everyone on the same page in terms of what sustainability is. We've seen, as in the top picture, sustainability used to be viewed as something that you implement and then you can reach sustainability. Anyone who works in healthcare will probably better recognize the lower picture here, where it shows that actually in order to sustain, you're having to overcome barriers and address issues continually, making small incremental benefits that you want to maintain into the future. So it's much less an endpoint. It's much more of a process that we're all going through in order to maintain these gains that we're making. And the HEC definition here is really appropriate because it's about maintaining better practice, and it's just the way of doing things, and people continue to benefit from any of the services that you're providing. Next slide, please. So the other way to think about sustainability is to think about what you would measure. What would you say is going to continue beyond your project, or what would you see once the program is completely embedded into a service? Sustainability can be seen as multiple measurements, and here I've just outlined 8 of the most common. The one that most people think about is the continuation of benefits. These are, healthcare benefits or improved outcomes for patients or service users. Do those continue? That becomes most important. What is commonly measured, though, is the continuation of activities, whether or not the service continues to be delivered in the same way, is the educational sessions or the pamphlets or, a new innovative technique, and that continued. The Other measures here are probably less associated with sustainability, but they really provide insight into why sustainability is so difficult to achieve, because actually you're probably maintaining all of these other things at the same time. So, for example, things like having to maintain relationships, partnerships, and networks. In order to maintain your activities and your outcomes, you are obviously going to have to maintain your networks, work with groups within your own organization, and maintaining these partnerships takes up a lot of time and resource and energy from the team who's implementing. You also want to think about how you sustain the specific policies and procedures that you've put into place. How have you used your project to change organizational policies and procedures? And how will that change or remain once the project or the program itself isn't seen as its own entity? It's actually just built into a service. There's a lot of work around also maintaining attention and awareness. And if you're looking at sustaining a program, you really have to think about how people continue to be engaged in an issue or a problem, and how that can be continually provided. So sustaining that attention and awareness is actually a job in and of itself. Number 6 is around sustaining the skills and capabilities. Often, in order to continue the activities or the interventions for your program, you have to make sure you're training staff, stakeholders, and the community members to use the service or to deliver the service. And if there's no plan to continue the skills and capabilities, that is something that will really impact your ability to continue into the future. And the last 2 are a bit different views of sustainability, but the importance of innovation and adaptation in measuring sustainability is much more recognized because, as I said, services do evolve as time passes. So you might sustain by actually changing, but still delivering population benefits, changing to align with new evidence. As we know, new guidelines are produced every day. New ways of delivering services change. So everyone has to be conscious of how they're innovating and adapting as well. And then finally, a much more specific type of sustainability, but it's around recovering the costs and being able to actually financially deliver a program within the specific, financial envelope, and whether or not you're able to continue that into the future. So hopefully this list of all the things that need to be sustained helps you to understand the complexity of sustainability, but also the things that you can target in order to make sure that you're making the biggest impact for the long term. Next slide, please. So I'm sure I don't have to explain to this group why sustainability is important, but just to reiterate probably what you already know. In order to provide care that is equal, we really need to be conscious of not providing services that impact groups disproportionately. There's been a lot of findings recently because of the pandemic that groups are disproportionately impacted by services or access to care. And we need to be conscious of not making those gaps bigger by making some services maintain or sustain and embed in certain locations and others that fail to sustain. As I said at the beginning, there's a lot of waste associated with this, not only financial, but human resources that are going in, a lot of effort from the healthcare staff and community workers and different organizations putting in a lot of human resource into new programs. So we have to be conscious of not wasting their time, because this contributes to the third reason, which is declining support. And this is related to the fatigue. And I think we've seen that a lot recently in the last couple of months, the declining support or the lack of enthusiasm for continuing to implement different or new programs because people get project or program fatigue. So we know now that actually if you are involving groups and stakeholders in multiple programs that fail to sustain or show long-term impact, they're less likely to want to be involved in future initiatives. And then finally, more ethically, the consideration that we should be embedding programs with any of the finances that are dedicated to them. Services are usually delivered because they're known to provide a service that is necessary and will benefit healthcare or population outcomes. And if we are only testing them out and not thinking about how they can actually be delivered realistically in care, there are some who have begun to question whether or not that is actually an ethical issue. Is it the job of the staff and the local communities to continue to do this work for people who want it to be implemented, or should that be part of the initial plan? So just something there to think about. Next slide, please. And I just really wanted to drive this home about why sustaining improvements is particularly important. As I said in one of the first slides, we have seen a lot of rapid implementation and rapid changes to services in the last 18 months. And the initial drive was really firefighting and addressing issues, of getting services off the ground, really providing those the services that were needed within the community at the time of the pandemic, getting those things out. But now that we have had a chance to see the benefits that these services are providing, there's a real risk of having all that improvement lost if we haven't been able to integrate any of these new programs into organizations and systems. And this will cause significant consequences for patients, service users, and staff as well, as they have to either go back to providing less less appropriate or tailored services. So the decline in benefits and processes and practices can really be seen if we start going backwards, and that will be felt by the services equally in terms of, as I mentioned before, of project fatigue and things like that. So the focus now really needs to be on persisting and adapting. And I mentioned the importance of adapting and innovation to sustain. And this is something that as a group and as people who deliver services for communities, we really need to think about, but we also need to be viewing this. It's called the systems resilience. It's a way of responding and being able to actually see the current context and respond to it and meet the given needs of the situation. And that needs to be where we're focusing our efforts now with all of these great implementation programs that we can bring forward into the future. Next slide, please. Perfect. So what does this mean for anyone who delivers care, anyone who delivers programs that are meant to benefit communities and the health and well-being of populations? Well, it means that staff have really had to learn how to persist and adapt through these continuous challenges. And it has required increasing amounts of flexibility and creativity because, as you probably have experienced as well, these initiatives and programs are having to stop and pause and rapidly change to meet all of these new rules or ways of working. So teams are really engaging in a wide range of strategies to embed and maintain improvements. And I'm going to share some of this learning with you about some of the strategies we've seen that work in terms of sustaining. Next slide. So before we get into the strategies, I really wanted to give you an overview of some of the recognized challenges that people are facing. Next slide. And we know there are a number of reasons, but here are a few that I think we've really seen come to fruition during the last 18 months. The real problems with sustainability come from a few things. The first I'm mentioning here is this belief that improvement or programs, once the funding ends, just continue. You've tried them out, you've had some staff working on it, it will just work. And this leads to what I like to call the invisible work of sustaining, because often you lose that attention and the work behind the scenes to continue implementation obviously continues. The effort, the data collection, your evidence base and building your case still continues. But often that you have lost kind of the spotlight at that time. The next reason is around competing priorities. And this is because, we get so many changes to strategies and systems and things that are coming about. So there's constant innovations being flooded into the system. And this really complicates the process of being able to gain buy-in from leaders, from managers, from executives, anyone who can support the work, causing people to not be able to sustain because they can't actually keep up with the changing strategies. The third reason is around becoming flavor of the month. I think sustainability is what I like to call the ugly stepsister of implementation. It's the hard work. It's where you don't get the spotlight anymore. And often after people take initial interest, maintaining that momentum and interest from stakeholders is incredibly difficult and is in itself a full-time job. And then finally, the changes in staff and stakeholder and loss of support and loss of staff for community programs and healthcare initiatives really takes a hit to sustainability. Adapting to new leadership takes a long time. We see a lot of churn of leaders in our projects. But this also means that you're constantly reestablishing the case for your initiative and training staff continually. So these are really complicated problems that everyone seems to face to some extent. Next slide, please. So it's not all bad news, and we do have some insight into how sustainability can be managed and supported. The first is to really take the time, hopefully the session will help with that, in order to take a step back and to start to think about the bigger picture and where the program wants to be and what it can realistically do in the long term. Ideally, you want to think about long-term success as early as possible, because if you can do so, you're able to have the underpinning foundations to ensure that you're embedding and integrating your work within a system. So it's not a standalone project that isn't able to be sustained without specific individuals or groups. The third way it can be managed is to really think about sustainability factors. We know a lot about factors that impact sustainability, and we'll talk specifically about those. And then we are also can suggest some key strategies to employ around the themes of engaging and integrating and adapting. So I was going to give you a overview of the foundations for sustainability here. And this is where I'm picking out the management of sustainability factors that have been recommended. This is from a specific tool called the Long-Term Success Tool, which has 12 factors with 3 domains, practice, setting, and people. And understanding and being aware of these factors is going to help you to build those foundations for sustainability, understanding what to do and who to contact and what to act and how to act in order to sustain into the future. So the first theme, next slide, thank you, is around people. And this grouping is 5 factors that look at the people involved in the initiatives or programs, and it highlights their potential impact on long-term success. So the first factor is around involvement. And this specifically asks about the engagement of staff and service users. Who needs to be involved? Who is impacted by or delivering this program? Do they feel like their views are taken on board? Do they understand and buy into the project or program itself? And how are their views incorporated into the delivery of this project or program? The second factor is around skills and capabilities. Because staff and the people delivering change obviously need to have the continual skills in order to deliver a program successfully. So considering how you can build in consistent training for new members and how that can be planned for is incredibly important to sustainability. Leadership requires a strong leader who are approachable and available to garner support. Leadership is huge in terms of gaining continual buy-in and support for staff to be involved in a program. And whether or not that's in place will affect your sustainability. Team functioning is important because it explores the accountability and the responsibility of workload for programs. And often in terms of sustaining, this is an area that doesn't get explicitly talked about. People assume that people understand the workload associated with a program, but actually that knowledge is often tacitly held within individuals who are doing the work. So for sustainability, that creates a challenge, because if individuals are doing something, what happens if they are not there anymore? If you're not able to have a full team who have wide understanding of the responsibilities, your likelihood of sustaining is also compromised. And then finally, the general commitment to the improvement. Do you personally, or do people generally and the organization have commitment to this program? Do they feel like it's something that should be delivered and they believe in? Is there a shared aim established? Because if people can buy into an idea, it's much easier to gain continual support. And people need to have an understanding of what the program is trying to accomplish, that they can communicate, and that can be used to continually engage and raise the attention and awareness for this piece of work going forward. Next slide, please. The next domain is around practice. And practice explores 4 factors for sustainability that influence the multiple resources and systems and processes that support programs. The factors reflect upon all of the structures and resources that are available and focus on how improvements for programs can be observed and monitored over time. So the first factor here looks at how you can measure and understand adaptation to local processes and emerging needs. There's a lot of evidence that says if a program isn't adapted to local context, stakeholders, service users, it's very unlikely to be sustained. So understanding how you capture and make changes to a program are almost as important as trying to implement it in the first place. And understanding that adaptation is part of sustainability will help here, because a lot of people try to remain very close to the original intervention, but actually in terms of maintaining that into the future, it can be detrimental. So understanding the role of adaptation to make sure a program works within the given resources is incredibly important. The second factor here is around progress being monitored for learning and feedback. It reflects upon whether or not you have the programs and the systems in place to monitor the initiative over time. How will you know that you're making a change? And how can that be communicated to staff and other stakeholders so they can continue to buy into this? And that links directly to the evidence of benefits. If you can't show evidence that your program is, being able to deliver the benefits that you had initially anticipated, it's very unlikely that you're going to get continual buy-in. And this is complicated for a number of the teams that we work with because evidence of benefits takes quite a long time. And I'll cover that a little bit later in some of our strategies. But without that evidence, you are very unlikely to be sustained because people won't feel that there is the basis for continuation. And then finally, resources in place, the funding, the staff time, equipment, infrastructure, and facilities. This is often what people think about when they think sustainability. We need the funding, but it often is the underpinning of a lot of the other things. If you don't have funding, it's often because you don't have the executive or leadership buy-in, you don't have the staff buy-in. So they're all connected in a way. And resources, having those in place is part of the puzzle, but it's not the complete piece here. And then finally, the last 3 factors are around setting. And setting looks at the wider environment in which the improvement takes place and looks at the broader impact of long-term success and what that would mean. So the factors here are, the first one's around alignment with organizational culture and priorities. And political and financial environment. It's the awareness of the impact of the political and financial changes that are taking place in the environment at the moment. And I think this will largely impact groups on this call today because from what I've heard about the programs, it does sound like there are changes that were available because of the pandemic. So if you aren't aware of how some of the external influences are going to impact your project, you're very unlikely to be able to maintain or to tailor your project to respond to some of those financial and political needs. So being aware of those will help you to plan your project appropriately. The second factor here is around the values and beliefs held within an organization. And this is really important in terms of sustaining a culture of continuous improvement. Do people feel like they have the permission to be involved in programs? Can they do the extra work to collect information and data to support staff and patients to be involved and to continue to try to implement and integrate a service? And then finally, it's alignment with organizational strategies and priorities. And this looks at the need to align your programs to organizational strategies. This is really crucial in terms of gaining executive or managerial buy-in, as well as having the initiative becoming part of the organizational policies and procedures, which will of course help you to sustain. And if you have that organizational buy-in, that process becomes much more smooth as you get the permission to make changes at speed, actually. And that can really make a difference in terms of your overall sustainability. Next slide. So those were 12 factors for sustainability. And I know that's a lot to take on, but it really does show the number of different elements that need to be considered when thinking about sustaining, all of which you can think about in isolation, but at one point or another within your program, you will need to think about all of them at the same time to understand your real risks and where you might need to take action to sustain. You might also want to have discussions with those in your team or your wider organization about some of these factors, because what is very clear from the work we've done is that no one person usually has all the answers to all of these factors. You won't know all of the information. So having a wider team perspective and having a discussion about sustainability really feeds into that first kind of lesson about managing sustainability in terms of stepping back and looking at all of these factors and thinking, where are gaps? Where do we really think we might fall down in terms of our long-term success, and what can we do about it? So that leads me quite nicely on to the next section, which is all around strategies to enhance sustainability. So the majority of the current work in this area really does focus on whether or not something fails to sustain or sustains. And with little work to understand the links between these outcomes, we don't have as many actions or suggestions on what to do. So we studied a number of our teams over a 3-year period to say, what can you do to sustain? What were the challenges you faced, and what actions did you actually employ to overcome them? So these are some findings and learning that I think hopefully will be appropriate and resonate with you guys as well, from a study that we took with some of our cases. So next slide. In terms of sustainability challenges, I've kind of alluded to these, but I really wanted to reinforce that projects and programs seem to face 5 common challenges for sustainability. The first is workforce stability. With all the programs we've worked with experiencing staff turnover, particularly nurses, doctors, but also volunteers in more of our community settings as well. And during the pandemic, we've seen a lot of our programs really struggling with volunteer recruitment and maintenance over the time, because actually volunteers and staff everywhere have been burning out. It's been a lot of pressure for everyone involved. So this staff turnover really creates issues for sustainability because it hinders handover and continuity as staff move on. And this compromises what we called initiative memory, or just the feelings of understanding what was going on within a project. Once that leaves with an individual, that obviously will compromise its continuation, because as staff with significant experience and expertise is lost, you don't have it anymore, and it really compromises your ability to have that learning. And this requires teams to not only plan for extra training, but it also means you're continually reestablishing relationships with stakeholders, which is a lot of work. The second challenge that we saw from all of our teams was around change timelines. And what I mean by this is that producing evidence of benefits during a funded period of time for a project is a shared challenge for all of our teams. We know that initiative planning and setup take a lot longer than anticipated by most teams. And this limits your ability to collect measures and to provide case studies, and perform meaningful evaluation for any of the programs. Third challenge was around consistent and continuous support from organizational leaders or managers from across all of the work we do. We had a lot of people who described challenges because of competing priorities. There was a lot of fluctuating challenges that people had to respond to, fluctuating strategies and priorities, but also significant changes to infrastructure and systems, as well as financial cuts and constraints, and competing with different innovations that were coming up and new bids all the time. So it became a very complicated, as it was always complicated, but it was even more complex in the last year as cases tried to survive with all of this background noise happening around them in terms of changes. And then the fourth challenge that we saw for all of the projects that we've managed is around garnering and maintaining stakeholder support. Because as I said in the previous slide, often it's easy to gain some interest initially as people are like, oh, it's something new and shiny. I can get on board with this. What we found is that actually after the initial new innovation kind of label wears off, it's a real challenge because you're having to re-engage and get involvement from stakeholders continuously. And this limits the ability of you or others to understand the experience of staff and patients, because if you can't get the stakeholder engagement, you really can't learn about the implementation in a meaningful and fruitful way. So in terms of sustaining, it became very hard to add those examples and of the needs and the benefits of some of these projects without the stakeholder support. And then finally, the issue of capacity for implementation or improvement. We really found that a lot of people undertake a lot of improvement program work on top of staff day jobs. And this results in a lot of the projects relying on core individuals or groups. This is obviously a risk to sustainability because without these individuals, we're seeing less data collection. You know, the delivery of the project itself is falling down. And this means that the initiatives are also not viewed as organizational priorities. They're seen as individual projects that are owned by certain staff or staff groups. And that's really bad for sustainability into the future. So with these 5 challenges that we saw across all cases, I think the most interesting part is that we were able to also ask and study, what did you do to mitigate some of these risks and how did you support this challenge in practice? And next slide, please. We discovered 9 separate strategies that we found that people were employing to help them sustain their benefits. So next slide. Some of the quotes you'll see here are from our teams and that they've suggested or said throughout our interviews that we conducted with them. But the first 3 strategies are around engagement. Teams were really clear that you could use strategies to promote recognition or use and development of relationships and partnerships to support sustainability. The first strategy was around involving service users in the initiatives or in the programs itself. And this is really interesting to us because why and how would involving service users support sustainability? And it was clear that they did so in a couple of ways. So the first was the ability of service users to act as a catalyst for change. And that was what someone said, a catalyst for change. They really became the pull for the improvement. And they were felt as a key stimulus and in terms of pushing the team and inspiring action for continuing improvement work. They provided the real life stories that people wanted to respond to continue to deliver a service because they saw that it was working. The second role of service users in sustainability was really around informing and designing key outputs, asking service users to be part of the program team and co-producing things like products, or we had one example of a patient held health record, and that was informed directly from the service users and how it could be designed and how it could look and how it could be carried by the service users themselves. And we found that this really enhanced its usability and effectiveness for the other service users, leading to more people wanting to use the service. And the third benefit that we saw was around service users really being able to maintain that attention and awareness. We know that's one thing that you have to do in order to sustain, is maintain awareness and maintain attention to your work. And service users were completely, integral to having this happen. They were championing the program's different sites and at key events. And this became very important in terms of sustaining many of our programs. The second strategy here was around engaging with senior leaders. All teams needed to engage with senior leaders in order to sustain. And this was due to their ability to advocate for the initiative and gain further commitment from staff members. So teams were really strategic in identifying and targeting key leaders at specific meetings and events. And they did this by preparing specific presentations to say how the initiative itself could support organizational priorities. And actions such as these enable the teams to maintain support for the work and also continue to gain ongoing commitment from staff. And then finally, in terms of engagement, the last strategy was around building collaboration and networks. Interprofessional collaboration with partners, networks, and staff groups was a facilitator for sustaining, because it ensured that staff were engaged in diverse approaches to deliver the interventions effectively. One of the key challenges was around individuals delivering these programs by themselves. So obviously, having a mechanism to engage further staff groups or further staff members in delivery was very important. So teams did this in a number of ways by setting up network meetings, attending forums where they could talk about the program to build their contacts. We even had people doing collaborative funding mechanisms, linking with the people in their own area who had similar aims to build a case for larger commitment to a topic became very important. And all of these actions for collaborations and networking, it became a continual platform for ongoing engagement with staff and stakeholders. So that meant that they had a way to continually gain support for their programs as well. Next slide, please. So in terms of strategies to sustain, the next 4 were all around integration. These strategies enhanced initiative integration within systems and help participants to not only understand initiative progress, but they're also crucial for consistent delivery and maintenance of each of these programs. We saw this done in a couple of ways. The first was by building in and planning for accountability. We knew that it was extremely important to explicitly outline program workload, and staff were very clear that they needed to ensure that people were aware of their role in programs and how this could continue into the future. And this was done in a number of ways, in terms of informing workforce planning, adapting job roles to include some of these new key tasks that were associated with these programs, and changing job descriptions so people actually were aware of their roles in delivering these new programs. And this was very key in ensuring that they were able to allocate tasks and the responsibilities would continue into the future. The second strategy here is around impacting organizational memory. And what I mean by that is finding a way to integrate programs into systems to support transitions for staff. Now, integration occurs in multiple ways and can occur across multiple levels, but we saw things like integrating programs into documentation processes or into education and training as well, ensuring that you're able to consistently collect data and gain feedback for the program. And any actions for integration around here were really key in ensuring that there was a legacy of the initiative that existed beyond the knowledge of individuals, which is really important in terms of maintaining past specific staff groups if they do move on. And the third strategy here is around consistent and continuous training capacity building. So it links to integration, but we also found that to ensure that staff have the capability and capacity to deliver the work, programs all needed to engage in some form of continuous training. So this can include adding programs to program information to induction presentations or packages. Can it be part of how you take on new staff? It should be taught to them at the very beginning. Having these slide decks or anything that explains a project can help you to not have to constantly re-engage with training if the materials are already produced. So having that as a key step is very important. And this strategy really helped to embed the initiatives into routine practice because it increased staff motivation for the delivery because they saw it as something they were prepared and knew how to do. But it also, of course, enabled a wider workforce to actually deliver the program. And then finally, around measurement, embedding measurement and monitoring. The ability to have measures in place was really key in terms of sustainability. Because if you can collect measures and you can show people the incremental changes that you're making to services, you're able to create a case for why you should continue. Now, the broader impact, like outcomes for well-being or health, those are harder to collect, but our teams found it very helpful to collect process measures. And what I mean by that is things like how many people were educated, how many people entered into a service, how many meals were given or care packages were given away. This would allow them to engage in reporting measures to their funders, to their executives to say, although we have not been able to show that, we've decreased social isolation or, mental well-being is increased from this project, we are able to say we are making contact with X amount of community members and they are benefiting from this service. Also using key statements and kind of case studies to show the impact is really powerful as well. And then finally, the last two strategies here are around adapting. And these are very practical strategies that are there to help you understand emergent conditions and contextual needs. The first is around just adapting the initiative to really suit the context and the people involved. As I said, if you fail to adapt, it's very unlikely that you will sustain. Programs need to understand, of course, the contextual needs by listening to staff, understanding staff feedback, understanding organizational limitations, and of course, the emerging evidence of what's required. So for example, we saw teams making iterative improvements to documents and service pathway or care provided, listening to feedback of staff about how forms were working or not working, or how information should be collected was very important in terms of gaining continual buy-in. These iterations or changes that you make to programs are important to sustainability because they allow you to design the program to meet the organization or the environmental kind of characteristics or needs. And all of these adaptations are necessary to continue the delivery of the program. So the final strategy is around reducing the complexity of an initiative. And this is a really tough one because a lot of our teams, obviously, you want to deliver the most impactful program that is possible for you. But when you are at a place where funding is complete, or you have only an X amount of staff or resources available to you at a given time, a strategy that a lot of our teams used was really reducing or changing their scope of their initiative. The rationale for this is really around fostering lasting change that can realistically be delivered within your available time or resources. And this is important to sustainability because it allows programs to understand how to actually work within the systems they're in. It also was key in giving teams the opportunity to adequately consider how to build in mechanisms for continuation. So being smaller and getting bigger is often a good thing for sustainability. This can pose challenges in terms of your evidence of impact, because you might not impact as many people, but fewer people is better than no program at all. And I think that is a tough call that some programs do have to make. And that's just the reality of making improvements in care in the current context that we're in. So those were 12 of or 9 suggested strategies that we found worked for our teams. And I really hope that you were able to benefit from those. Oh, sorry, we were supposed to move on to the next slide. I don't know why mine changed. Oh, okay, so sorry, these were the integrate and adapt and reduce change in scope of the initiative. But as I said, these are 2 that allow you to understand the emergent conditions and contextual needs. So I'll let you sit with those for a second. But overall, these are just 9 suggestions of programs and projects that have used some of these strategies. And I'm hoping that some of them will resonate with you in terms of actions that you might think about or consider for your own programs to sustain into the future. Now, I think we have a quick little poll, because it'd be great to get some insight from this group on what sustainability looks like on the next slide. Thank you. So as we talked about at the beginning of the session, sustainability really can be viewed in a number of different ways. So it would be great to get some insight from this group on how and what you think you would like to sustain in the future, because that will help you to focus on some of the actions that you might want to take. Is sustainability for you about maintaining the outcomes and the benefits from the work that you're doing? Would you like to more concentrate on continuing to deliver the service and the activities of the program? Are you going to have to concentrate on building and maintaining relationships, or keeping procedures and attention on top of your list? Or equally, are you thinking about more innovation and recovering costs? So if we can just pull up the quick poll, we will take a look at maybe where some of the priorities for this group are. Great. So it looks like a real mix, actually, which is really interesting. And I think it's actually maybe telling about this group that a lot of the groups are looking at maintaining relationships and partnerships. And I'm glad that I can see that here, because it is a big part of sustainability that often isn't thought about, because you can't maintain anything else often without having these partnerships or networks available to you. So understanding how you keep those alive and the mechanisms for continuing those networks into the future are going to be really important for this group, it looks like. Great. Well, I think we can probably move on to the next slide, unless someone wants to come in and talk about the results. Yeah, okay, thanks, Lindsay. So just as a sum up on the last slide, some principles for everyone to kind of leave with and to think about. Of course, if you can, consider long-term success and sustainability as early as possible, or begin thinking about it as soon as you can. Reflect upon some of the factors that we talked about. We talked about 12 specific factors in this talk. And if you can, review them regularly, because things are changing so rapidly within this area that you probably will need to revisit them. And then finally, think about how you can identify some of the risks that you might face in those factors and the specific strategies that might help to support you during that time. And then finally, even if you can have a conversation by stepping back for a moment or two in the next couple of weeks with your team, I think you would find it very, very helpful, because often you will never think about sustainability. You might always be concentrating on firefighting. So doing that as soon as possible, hopefully will support you in the sustainability journey. So thank you so much. That is the end of my talk. I think there's a slide for questions and a slide for contact details if anyone has anything they'd like to follow up with me on after. But yes, happy to have a quick discussion if anyone has any questions.
Thanks so much, Laura. Really important conversation to have, and I think timely given where this webinar series is at and where folks are at as they plan to move into next year as well. Ryan, we have just a couple minutes left. I wonder if you want to jump in with a question.
I do, and thanks so much, Laura. That was really, it highlights the importance of having the conversations about sustainability as an ongoing thing during the life of the project. And I'm wondering, given the 12 factors that you've identified in terms of sustainability, and I think it also highlights in some ways the complexities of trying to get those sustainability initiatives ingrained. Do you have any ideas or thoughts on how you actually keep your eye on the end goal while you're managing those 12 factors in sustainability and kind of keeping everyone going towards the same endpoint?
I think there's a number of techniques that people use, but it is beneficial, and I'm not sure how much of these kind of techniques are used within these groups, but we often have either a program theory or a driver diagram that we continually can revisit, because I think you're right. If everyone could get on the same page in terms of what you are trying to impact, that would really cement where the actions need to be to sustain. So I think that does go along with the commitment to the improvement factor, as well as, you know, the involvement, because if you can do that as a team, that would help. So having that key aim almost as a framing for all of your discussions, I would think would be important. So yeah, that's probably a different technique, but I think most people have a overall program diagram or something like that that they can focus on.
Great, thank you.
Well, a special thank you to Laura for today's discussion. And as she said, she is reachable. If you have a specific sustainability question or challenge you want to pose, feel free to reach out to our team, reach out to Laura directly, and we'll make sure that connection happens so you can tap into that expertise. Today was our final scheduled webinar in the Virtual Learning Together series, and I want to thank each of you for participating in the series and really for your commitment to serve individuals and communities across Canada during these unprecedented times. In March 2021, the webinar series began with the intention to connect bed-based substance use centers and emergency shelters so that lessons related to pandemic response and recovery could be shared. We invited speakers from across the country to deliver 15 unique learning opportunities that focused on topics such as infection prevention, supporting people in the workforce, harm reduction, and equitable care. We're really grateful that you were able to join us throughout the series, and we're pleased to share that the webinar recordings and summaries are available on the Healthcare Excellence Canada website. Thank you again to each of you and to our partners at the BC Patient Safety Equality Council and Centre for Substance Use and Addiction. And we'd love to get your feedback now. So we're going to pull those feedback polls up on your screen. The first question is, I know more about sustainability and strategies to sustain gains than I did prior to the webinar. And that goes from strongly agree to strongly disagree. The second question is, overall, I was satisfied with my webinar experience, from strongly agree to strongly disagree. And lastly, I'll be able to apply what I learned from this webinar in my work. Again, strongly agree to strongly disagree. So if you can click submit on the bottom of your polls, that will share the answers with us. And thanks again. Goodbye for now. Stay safe.